back to my channel in English for Nursing Communication 2. This is Ruffel Manalo from the Faculty of Nursing, Nakhon, Rajabhat University. So we are going to discuss about the concept of writing in nursing part 1. So as I have mentioned, this is a teen teaching course by the three of us from the Faculty of Nursing. So for the objectives, so at the end of the course, each student should be able to first differentiate between experiential and reflective writing, determine the importance of writing in nursing, third, identify the techniques of writing in nursing, fourth, implement the rules of writing in nursing, and as an overview, we all know that writing is a medium of human communication that involves the representation of a language. That's according to Wikipedia. Also, Merriam-Webster says writing is the act or process of who writes. So let's discuss in details about the experiential versus reflective writing. So in experiential writing, the writer expresses his or her thoughts, feelings, and ideas. While reflective writing, the writer expresses the impact of his or her experiences. So that's the difference between the two. So the importance of writing includes it's essential and it reflects the activities of nurses and other health personnel organized and care every details of the patient's condition. And second, it is crucial in nursing profession to portray and write everything about activities given to the patient. Third, it demonstrates professional communication and is widely used in a daily basis. So not only in a certain country, but it is used worldwide. Fourth, it is needed in sharing ideas and knowledge about your patients. Fifth, it is used to express thoughts on the observation of the patient's condition. Your patients could be having mild problems to severe problems in the hospital. Six, it improves the skills and prevents writing errors. So writing is very important because it is for us nurses to prevent errors that could cost even the life of your patient. So as nurses, what do we write in our nursing profession while we are attending the needs of our patients in the hospital? So as a nurse, we have this type of stuff that we need to write. We have our resume, we have to write the patient health history, we have to write the nurse's notes, which is very, very important. Every end of the shift, we have also to write the nursing care plan, which is very important on how we plan the care of every patient. Every patient has a different need. So we need to have a care plan. We also have nurse report that takes place every shift of work in the nurses station. Also case study of our patients and laboratory results, which is very important for us in order for the doctor to treat the patient. They need laboratory results and we need also to be updated so we would be able to know the condition of the patient every now and then. So with writing in nursing, you should follow all the basic writing standards as well as be aware of the peculiarities of your specific discipline. First, we have to demonstrate our critical thinking, proper punctuation, and grammar construction. Writing is very, very important. Every details of your patient's records in the hospital is very, very important, especially in the outcomes of care. And second, we should write readable details, easy to understand terminology. So in nursing, we have different terminologies that sometimes would confuse other people at work. It's because they're not familiar with it. So third, we have to master the discipline of using appropriate language. So each country, we have different language. So we have to use that, and it should be in detail. Write well, okay, especially on the explanation of complex nursing procedures. So in nursing procedures, some are easy, some are difficult. So it's very important to write the essentials of the procedures being done to your patient every now and then. And the fifth one, we have to describe the nursing processes and procedures step by step. So not, we don't only need to explain that on how we write on the patient's charts or in the patient's record form, but also we also have to um, explain this to our patients because we need patients' collaboration or cooperation during the administration of every procedure and nursing processes that we are implementing to the patient. Sixth, write clearly and comprehensively. So this is very, very important because of the time when we are at work in the hospital, we are so busy. So we need to write clearly and comprehensively. Seven, use the third person or second person perspective. So we have to be mindful of this. This is very, very important. So let's check the rules of writing in nursing. So when writing your assignment in nursing, you should always remember three important rules. You have to be objective, what you saw in the patient, what we observe in the patient, by our eyes, by our nose, by our feelings. We have to be very, very careful with that. So we have to be very objective, be precise. So we have to be accurate, comprehensively write the essentials about the patient. So you have to remember that and always be very careful, especially when you write complex nursing procedures or procedures that is not very common or done, seldom in seldom done in the hospital. And to conclude, writing summarizes the main points and draws ideas that are interrelated in assessment, diagnosis, planning, implementation, and evaluation of patients using the step-by-step process. So I hope you got something out of this discussion. Thank you very much. And if you have any inquiries, please don't hesitate to send me a message through my email, line, or messenger. So till next time, take care.